Welcome, 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 everybody, to our What to Know Wednesdays Ramp Real Access Motivates Progress podcast. I'm sorry we weren't with you last week, but I was away competing at nationals, and I am back. Today we have a fantastic lineup for you. We have Bayata Home Health Care with us today. We have Ashley Sadler and Mike Skolowski, and I know I butchered that, and I'm sorry, Mike. We will fix that afterwards. But they are going to tell you all about what Bayata does and what they can do for the disability community. So I am so thankful to have our two guests with us tonight, and let's get started. Ashley, why don't you tell us a little bit about yourself and how you got involved with Bayata?
Sure. Thank you so much for having us tonight. This is just a great opportunity, and we are really thankful to be able to speak with you, but also your guests and your listeners. So, my name is Ashley Sadler. I am the Director of Government Affairs for the Northeast region for our company. So I cover New York, Rhode Island, Massachusetts, New Hampshire, and Vermont. So I have this amazing job where I get the opportunity to build relationships with clients, employees, elected officials, regulators, etc. Then find ways to ensure access to home care services. So listening to a client talk about not getting enough home care hours, or their success with navigating the healthcare system, or sometimes there's these one-off issues that nobody intended to happen, but it only comes to light when a client or a family member or an employee kind of talks to us about it, and we're able to bring it to somebody to make a change. So I also get to monitor any of the regulatory or legislative changes in my states that could impact how we do business or how we provide home care services. So if there's some type of regulation that affects the business community, and we see some type of roadblock or issue with our specific home care industry, then we talk about that and try to help all parties kind of get what they need out of whatever the intended legislation or law might be. Anything you want me to keep going? Do you want me to?
No, I mean that's great. I mean, we met at the State House is how we ended up connecting with each other, just happening to be both advocating for the same thing and being at the same place at the same time. So what you do is absolutely wonderful, and why I wanted to feature you tonight. And Mike, let's tell us a little bit about yourself and what you do at Bayata.
Thank you. Mike Sokolowski. I'm the Associate Director of Grassroots Advocacy. My background before Bayata, I worked in many aspects of long-term care. I worked in a rehab hospital, long-term care facilities. I worked in workers' comp and health insurance. And I also worked in hospice before finding my sweet spot at Bayata Home Healthcare. I've been here for almost 10 years, and I've been promoting services provided by Bayata for 7 years in Northeast Pennsylvania. And then 3 years ago, I transitioned into this role, grassroots advocacy manager and now director. And what my role is working to get our volunteers within the organization that have a primary role to also have a secondary role as an advocate on behalf of our field employees and also our clients and their families. And I was one of those volunteers in my primary role before I took this position 3 years ago, and really love it. And I look forward to going to work every day, and that's a good thing.
Oh, that's a great thing. When you get to go to work every day, it's not working anymore. I absolutely love what I do working my organization. I love interacting with new people every day. So to me, it's not work. It's great. So tell me a little bit about how a person of disability, especially like somebody like me, who, just kind of fell into the disability community, like all of a sudden, how we can contact you, or how we can, start the whole process of getting connection and getting the services that we needed.
Mike, you want to take that one, or do you want me to?
I would say you with your background with the service offices.
Okay. So we are here to speak to everybody. Anybody that's listening here, anybody that has or just agrees that home care should be available for anyone whenever they might need it, right? So anybody that really kind of agrees with that message, we're here to help you get involved. Everybody right now is really looking for ways to get involved and make significant and meaningful change in our communities, and this is a perfect way to do that. There's so many issues that we work on, and we really need other voices besides just my voice. I'm sure people get our legislators or our regulators or whoever it might be sick of me kind of telling the same story over and over again, or giving the data points that kind of back up our issue. What really is resonating and what really brings the whole issue to light is when somebody tells their own story, or they're able to kind of give some insight into the personal part of how a certain issue is affecting them. So I would say if anybody's interested in advocating for home care, to email us at, Mike, I'm gonna give like the general one instead of your email, but just advocacy@bayata.com. And that will, if you want to just shoot us an email, we can just start a conversation from there. You can find us also on Facebook. We have a Facebook page called Hearts for Home Care. So you can look us up there as well. And also you could just email me or Mike, and we'll put up our email addresses at the end. And
okay, great.
We're happy to talk to anybody about that.
And I think,
and Mike, tell me how important volunteers are to this program.
Sure. So what we do, I briefly mentioned how in all of our offices, the staff have their primary roles, whatever it may be, but we ask at least one person per office to be an ambassador. And that ambassador is an advocate on behalf of our clients and field staff. And what they do is engage with our legislators and regulators. They are the go-between between what we do, Ashley and our colleagues, within the government affairs office in each state and on a federal level. And then we'll communicate with them so they could let their colleagues, field staff, and clients and their families know, and provide them with updates on what is happening in their state or on a federal level in terms of needs for rate increases, needs for insurance, whatever it may be. But whatever we're advocating for, those volunteers help us not only as communicating our messages to them and offering them opportunities to get behind what the initiatives are to support our home care industry, but also those same volunteers will go to lobby days at the state capitals and in Washington, D.C., take meetings with legislators in their volunteer roles. And what we ask of them is not as much to get the facts and the statistics as memorized, or don't feel uncomfortable going into these meetings. That's what myself and Ashley and our other colleagues will do. We'll talk to the legislators regarding that. What we ask our volunteers to do is just tell their story and paint the picture of what it's like to be living in your home and needing to receive home care maybe for the first time, or coming from institutional care back to home, and what the benefits are and what the opportunities are for someone to receive home care and still be able to receive all the medical necessary either devices, equipment, or rehab or therapy that they need. That institutional care isn't the only option.
Right. Well, aging in place, I'll tell you, whether it's aging in place or just functioning, because I don't consider myself aging yet, I'm staying still. But just functioning, like there's so many different things that people don't realize that home care takes care of. I'm pretty self-sufficient for myself, but like when we had a power outage and I was out of power for 6 days, major issue when you're in an electric wheelchair and you can't charge it. But it's not a life-altering event, so the power company doesn't put you on high alert. What are some of the things that during COVID that are your top priorities to advocate for? Because I'm sure it's changed due to the situation of the world right now. Ashley, you want to take that one?
Sure. Yeah, definitely. I think you hit the nail on the head, right? It's constantly changing. It's hitting a moving target. I think what home care needs as far as support goes is constantly changing. So some of the things that we have focused on and that we are monitoring and working on are first and foremost, it was PPE. So the personal protective equipment, the masks, gloves, face shields, any items that were keeping our employees safe. Obviously, at the beginning of the COVID crisis, we saw a lot of priority given to hospitals or facilities, and rightly so. But it seemed like home care was kind of, an afterthought or a second thought. So we just wanted to make sure that everybody understood that, our nurses throughout this pandemic and our CNAs and our therapists are still going into people's homes and still need to be safe. They're still frontline workers. And sometimes we're more of like that silent frontline worker, because you might not even know that your next door neighbor has a nurse
Right.
coming in every day to help them. So just, educating whomever it was that was providing PPE towards the beginning. Then, also looking at, telehealth, that was something that was important, looking at, I know there's executive orders throughout the different states that we have where, telehealth is being used more broadly. So looking at that, not only now, but then, going into the future. The biggest issue I would say is just this lingering kind of, or like this, we're not quite sure what's going to happen with state budgets, right? And now I'm talking about not only just Rhode Island, because I live in Rhode Island, but I cover the whole Northeast, right? So every state is feeling this budget issue, this shortfall, and we're all just kind of worried if there's no federal aid that comes through, how will states kind of balance that budget, because they'll have to. And is Medicaid going to be on the chopping block? And Medicaid provides a lot of the home care services that our families and our friends receive. So, that's just kind of a sitting and waiting kind of thing to see what happens. But definitely something that keeps me up at night, and will certainly be an issue once we determine how states will kind of move forward with the budget with or without federal assistance.
Yeah, and another thing that people don't realize is, like, my husband, he works on the front lines. He works for a home oxygen company who delivers hospital beds and oxygen, and so he's going into the nursing homes and he's going into people's homes. So he wasn't coming in my home because I'm at risk. So him being out in the high, so the budgeting and him not being on the front lines or getting hazard pay or whatever for being out there, but yet he still can't come home because he's really putting somebody at risk. Did you have any downtime, or did you have any customers that really felt the gap because they couldn't have people come in like right away until they could figure things out? Did you feel that stress at the beginning?
Yes, I think, and I'm speaking for the service offices. So from what I've heard across the states, is that there are some families that really, first of all, nobody wants home care, right? Let's just put that out there.
Right.
Home care is not something that anybody would say, yeah, you know what? I want a stranger coming into my home, or I want somebody else to come in and help me care for my own child. That's difficult, right? So during a pandemic like this, it's understandable that a lot of families would say, hey, you know what? Just to be safe right now, we're not going to take services, right? Or maybe that family has a member that's laid off or furloughed, and they're able to stay home and care for, their child or their family member, however, they might need to. So there was certainly a dip in services, but it warranted. I can totally understand that. I just had to make a decision whether or not my teenager was going to go back to school in person, or if she was going to do distance learning. And I chose distance learning because I'm nervous, right? So everybody should have that option. So yeah, it's starting to come back though. I think we've seen a lot of families that have kind of said, okay, as long as, the nurses or the CNAs have the right PPE, and they're, Bayata has these strict, stringent, procedures that we have to go through to keep everybody safe, and, these safety precautions. So I think that, when families see that and we're able to educate and let them know, we want you to be safe as much as we want our employees to be safe.
Do you have a check-in policy with those clients? Like, do you call and check in on them? You know what I mean? Like, throughout, to make sure that they're still doing okay and they're not struggling and they're not choosing, because we're not working right now, that, you know what I mean, I'm not getting the care I really need. because you know what I'm saying? Like, is there a check-in policy kind of thing?
I wouldn't say anything specific, but what we do, and I'm going to speak as myself. Back when I was a service director, before this position, I was the director of the Rhode Island Pediatrics and Skilled Nursing Office. So, we would never want to let there be any lost sheep, right? That's what Mark Bayata says. Mark Bayata is who started our company in 1975. One of the many things that he says that really resound with me is that, don't let there be any lost sheep. We don't want any clients or any employees too, right? Like any employees that have been out of work, we don't want them to feel like we've lost contact with them, or that, they're not getting the support that they're needed, or the communication that, we want you back when you feel ready. So I would say, from my own personal point of view, if I was the director right now, I would be making sure that all of my clients and all of my employees are getting that communication and that support. We really don't have a blanket policy that I'm aware of necessarily, but it's within our mission statement and who we are as a company that we really try to care for others the way they want to be treated. So hopefully that answers your question.
Yeah, I mean, I agree with that. Mike, with people choosing between jobs and healthcare and not healthcare, how hard is it right now to get volunteers or advocates to speak up and to tell because right now I think is the most important time for people to tell their story because of this pandemic. There are so many other things personally, I've been working with the state, and their hands-off delivery didn't work for the disability community. Leaving groceries on my front step isn't doing me any good when I'm home alone and I can't get them in, or if I couldn't see, I wouldn't know how many bags were out there. So we had to come up with other policies, and we came up with the whole Project Hello, where we were calling people who registered on the disability list in the state of Rhode Island to make sure that they were being checked on and making sure that they were getting the food and stuff that they need. But how hard is it to gather now stories and advocates at this time, being as tough as things are?
So about May, that's a great question. And we were on the pulse of this because we were concerned not about our ambassadors are purely volunteers to their primary role, and everything that Ashley said, that you had to shift gears and take on new responsibilities due to COVID. PPE in every service office that we had was a major concern, not only with Bayata, but in the industry, because institutional care was the focus across the country, and home care was not at the forefront. So we're feeling it out and trying to take the pulse of our ambassadors and the volunteers that are part of our Hearts for Home Care program. So we sent a survey to all the ambassadors that are in our core group. And of the 300, 280 of them still said that they are going to remain involved. They chose to do this, they weren't appointed or someone didn't tell them to do it. So this is something that they wanted to get into. And in that same survey, we asked another question about communication, like how often do you want to be communicated with? Is it through email? Do you want to have webcasts? And again, 70%, one way or the other, wanted to not have the same amount, but they wanted more information because they felt like they didn't want to miss out on what was happening because everything was happening so fast. And as of now, not that we're through it, but we went through at least the pain points of shuffling through COVID and handling all the internal policies and procedures. Our number of volunteer advocates is still the same. And of them, we have just as many legislative interactions today as we did last year, but at the end of the year. So we're actually ahead of the curve on interactions with legislators because of Zoom and Microsoft Teams, and some of the other interactions they're doing are sharing their stories that you did mention, the opportunity for them. Well, we're utilizing social media more for our advocates to put their own videos up and tell their story. And if they don't feel comfortable doing that, they'll share with us their story in writing, and we'll put it up as a PDF attachment saying,
Oh,
hi,
wow.
I'm Ashley Sabier, and this is my story. So in my role, I can't be more proud of the work that they're doing as our ambassador volunteers in each of our offices. And it goes to show that, again, they weren't pushed into this role. It's great that they chose to do it. They're probably overwhelmed the last few months, but still wanted to do something to stay involved on behalf of our clients and field staff.
It's true. It's so important, and we're such a community that's forgotten, but I really do agree that it's opened a lot of people's eyes, because the way I look at it is COVID gave everybody an internal view of what the disability community deals with on a daily basis. You can't go to your favorite restaurant, you can't go to your friend's house, you can't go here. But the difference is the world is going to go open back up and everybody's going to be able to get out again, but we're still going to be stuck in the same situation that we always have. So hopefully people have a heart and they realize how important this really is and start fighting along with us, because eventually everybody's going to need some kind of care at some point in their life, whether it's you personally or a loved one. What is the difference between an advocate and an ambassador, Mike? I know there's a difference, but what is that difference?
Sure. So all of them are advocates. The ambassadors are trained specifically to do more high functioning interaction with the legislators and regulators. And I say regulators because Ashley and myself, before we got into these roles in advocacy in our government affairs team, we both worked in the service industry side of Bayata, which had the opportunity to spotlight and feature to legislators, our clients, and field staff. But there's a great segment of Bayata employees that are considered support roles, where they don't have clients or field staff. They're in accounting, insurance, what have you. However, they play a vital role in advocacy within Bayata too, because they're working with the regulators in the insurance world and regulators within CMS, and taking meetings to show the logistics behind the scenes on how it's negatively affecting our clients in getting the hours they deserve, the reimbursement for the work that's being done in the home by either a direct care worker or a home health aide that reimbursed like a nurse or an LPN at least.
Right.
And so these ambassadors are the ones that go through monthly training. We have continuing education and a live full day training. Whereas the advocate within our Hearts for Home Care program, they're someone that has signed up. They have either seen us at an open house health fair, found our website and signed up to be an advocate. And we'll ask them to respond to action alerts, which are emails to their legislators that are filled with the content that we need the legislator to hear from them as constituents. We may ask them to join us on a meeting with a legislator and advocate, but not expect them to do the heavy lift during the meeting, but tell their story and what their pain points are a little bit less than what the maybe internal office staff will do when they paint the picture on. They're going to give the perspective of the worker, the client, and the family, and paint that picture for the legislator and how it all cohesively could be a problem. Whereas we'll ask the advocate to just tell their specific story.
Right. That's great, because I know I'm definitely getting involved in all of this, because this is right up my alley. What are
That's what
some
I
of
was
the key
hoping for at
points?
the end of this.
What are some of the key points that you think people need to be looking for right now during all of this, to reach out to Bayata to say, hey, I need this? You know what I mean? Like, I didn't hear about this, but I think I need something like this. What are some of the key points, Ashley, that a family could reach out?
Oh, I think my pros. Okay. I will take this one.
Okay.
So I would say, like I said before, if anybody that's out there that agrees that home care should be accessible, right? So if there's a family that has a child that has complex medical needs and they're coming home for the first time and they're authorized for, I don't know, 84 hours a week, that those hours, that amount of hours and that support will be there when they need it. So they can come home from the hospital on time and not have to, have a delayed discharge or need to wait a little bit until everything is in place. Same thing with, any family members that are leaving the hospital after surgery or after, a life event that really kind of changes that person's care needs. So,
Right.
for me, it's important for your listeners to understand that we really want to assure the general public that home care will be available. So we're not fighting for just Bayata here. We're really talking about the home care industry
Right.
in general. We want what's best
Well,
for home care.
yeah. It's really important because, I mean, on September 30th, 2019, as everybody knows by now, I took a double stroke, where I already had no use of my legs. I then lost the use of my left side and I had aphasia. So I ended up losing my speech, and me not talking is not acceptable. um, but they sent me home with the intention that you're already disabled and I couldn't expect miracles, so they weren't going to do much for me. How do somebody like me find, I mean, I did it through Google searches and stuff like that as how I found my own home care, but how can somebody advocate for themselves when they're sent home in a situation like that and say, hey, I need help and I know I can do better, but they're not giving it to me? Where can I go for that?
I
I
mean, it's
know in
tough. It depends on. Oh, go ahead, Mike.
oh no, I was just going to say again, both of us were in the service office role before we were doing what we're doing now. And I know one of the major components in our offices were providing the opportunity in the front part of the office for, it was almost like a library of opportunities in the community for our clients and their families to learn about other ways that they could receive care, either primary or secondary care, partner with organizations in the community that have like-minded needs. And also in that library or the collection they'll have in the office, and this is throughout all the Bayata offices, we provide this, and I know in a lot of not Bayata, but home care in general, offices will provide this, to make those connections like you asked, to tie them to other groups so that they know they're not alone, give them the opportunity to reach out. And internally, the office staff will even work with them to connect them with who the key contacts are at those sites.
That's exactly what RAMP does. That is what our role, we want it to be, is we want to be the middleman. We want people, because I have people reaching out to me every day. How do I get this and how do I get that? And when I did my therapy, I put it all out there online. I didn't care what I looked like or what I went through, because I figured if somebody else couldn't afford it or they couldn't get it, at least they could see what I was doing and what I was being taught. So, my speech and everything, we need more back and forth with smaller organizations like me to bigger, diverse organizations like you. We're stronger together. We're only going to make it through together, and we're only going to be able to help each other because we all need each other. So how can we get more smaller organizations like me to be involved with you guys, to make those connections to the little person who may not see it somewhere or may not be at a place where they're going to see it, but how can we make those connections?
I think that's a great question. And before I answer anything, Tina, you are one of my heroes. I have to say, what you went through and your transparency and vulnerability through all of it is one of the best gifts you could have given our community, right? Because not only did you have a personal struggle, but you put it all out there for others to see. And to see that it's not impossible, right? And that there's help out there, that the amount of people that responded and that were, checking up on you and that were, part of that village, right? Or it was just astounding.
Yeah.
So I have a lot of respect for you, and I'm so glad that we are here doing this today. So I would say for us to get closer and to do more, and this goes for any community or any small business in any state, right? Because anybody could be listening to this right now. Reach out to your local Bayata office and, talk to them about the supports that you offer. What I did when I was a service director was I would, invite different groups in to come and talk to my office employees, so that way they knew what was available in the community. And now with Zoom and Microsoft Teams and all of this virtual interaction, it's so much easier. Here, let's schedule a 20-minute lunch and learn for Tina to come and talk to you about what, she offers and how we can collaborate, because the system is so complicated, and not by, anybody's fault. There's just so many things available, and it's hard to kind of access everything. So the more we can kind of have those conversations, and just doing this is fantastic. And this is just a great way to promote just the good that's going on in the community, and being able to help people that are out there that might not know what's available for them, or, how to contact somebody to get the care that they need.
And I
And I
also
think,
find, I don't know. Go ahead, Mike.
Oh, I was gonna say, I think the major component of the community partnerships is awareness, what you're looking for. Not funny, but funny. When I got into my role with Bayata as a liaison, you would actually have people talk to you, and I said what I did. I was in home care. Their perception of it was literally home care, like repair, things like that. And again, these are my friends, and these are people that maybe worked in a hospital or nursing home, and they didn't look at home care that way. And I think what's key to all of this, to advocating, keys to what we fight for on behalf of our clients and our field staff on our end, and whoever else are in these groups, is bringing awareness to what you do in as many platforms as you possibly can. And I think that's the key to, solving a lot of these issues, is making sure we get the message out as much as possible in as many places as possible.
And that's exactly why RAMP started, and that's exactly why we're doing this podcast, because this is exactly what we need. But I find, and this is from my perception, so I want to have you guys key in on this, is I find somebody in the disability community finds me more legit than talking to somebody who's able-bodied and ready. That if I say to them, go to this place or use this place or use that, they're going to be more apt to believe that than somebody who's able-bodied and just giving them, because we vet the places, we really look into it. I will never recommend a place that I have not talked to several times, have, very much and been involved in. But do you guys find the same thing on your end, that the disabled community believes the disabled community, and you guys have a harder time breaking through, so you need more of us to speak for you?
Definitely. And I think we touched on this earlier, that, I could go in and have a conversation with a legislator or a regulator about an issue, and they may have seen me, 8 times in the past 12 weeks. And it's like, oh, here she comes again. We know what she's going to ask for.
Right.
But it's a matter of the person that's going through it being able to discuss how it impacts them. And I think that also goes, I think you're right. I think, clients or family members that are calling us for services, they don't know who they're talking to on the other end of the phone. And, it's customer service, right? Because you want to make sure somebody understands that you care about them. And I think at Bayata, we try to go the extra mile and build those relationships beyond just a phone call. We try to go out and do home visits. We try to make sure that our families know that the people on the other end of the phone truly care about them, truly want to make sure that they get the right nurse or the right CNA for like a match for their family. And we're not just trying to put a body into an open position. It's not about that. It's not about being transactional at all, because home care is so much more like a dating service, right? You've got to make sure that there's the right match, and the right match with like the right company too, right? Like sometimes somebody might call us and ask for a certain service, and we don't provide that, or we don't have the capacity to fill that case right now. Well, we have a really wonderful working relationship with the other agencies in Rhode Island and the other states as well that I cover. So we have no hesitation in referring somebody to another agency when it's necessary, because the ultimate goal is that our clients get what they need when they need it, and our employees are able to work and feel recognized and rewarded for what they're doing. And that's really what we try to do.
Yeah, and I think you nailed Ashley, a 2-word statement that she gave Tina, the home visit, where you're talking about hearing from able-bodied or non-able-bodied, getting the message, like if it's believable. I think the home visit, when we bring a legislator into our clients' homes to see versus hearing us tell the story. Yes, when we could have one of our volunteers tell the story, it's great. But when we bring the legislator into the home, it's such a difference to see the perspective that they get, and they think they know what's going on when we're giving these
they have no
stories
idea.
and giving fact sheets. And when they get there, my favorite 30-second story is one of Ashley's peers in a different state had really a hard time getting through on how important or how vital home care is, where this person was going to have to be institutionalized. And the legislator finally agreed to go on one of these home visits where we bring the legislator to the house. And what you were talking about before, Tina, with the not having power for 6 days. Well, when the family showed the generator to the legislator, and the legislator saw what was going on and how many, beepers and things, bells and whistles are going off.
Yeah.
And he said, well, what if the power goes out? That's the generator. The guy was trying to write them a check to buy a brand new generator because he was so moved by actually seeing what was going on in home care and what was being provided
It's so
versus
true.
telling the story. Yeah.
Well, I mean, everybody knows that I'm also getting a Habitat for Humanity house right now. We looked for 2 years, 2 solid years with congressmen and the governor and everybody helping me trying to look. They could not find me proper housing in a wheelchair. So I said, I have connections because I'm in the state house every week. And if I can't find housing, how do you think the layman, everyday person who knows nobody? So my house is going to be the model house, and I want everybody to come into my house to see what you need, what can be done, what can happen. Like, we lost power for 6 days. We're right now funding ourselves, trying to get a donation of a generator, because now I'm going to be out in Burrville. If I couldn't get power for 6 days in Lincoln, I'm never getting power out in Burrville anytime soon. Like, they don't understand. People are worried that, the food in my fridge might go bad. I said, that's great. I don't know how I'm going to the bathroom. I don't know how I'm letting my service drugs out. I don't know how I'm getting off this couch. They're like, do you have a manual wheelchair? Yeah, but I still need to go and find it in the dark. I need to go and pull it out in the dark by myself. You know what I mean? Like, these are things that people just don't see. Because they don't experience it, they don't see it. And this is why it's so important that we need to raise awareness for this, because people just don't see it. So I am so thankful for everything that you both do. Tell us something that you want to leave. What is the most important impression about Bayata that you want to leave with our viewing audience? Either one of you, pick one.
Yeah.
I'll go, Ash.
I don't know. Yeah, okay, go ahead.
All right, go ahead, Mike.
Yeah, sure. I think up until I started working for them, it was the quote unquote job everywhere I was before. And this is not a joke. When I first started working for Bayata, their colors are red. And you would hear stories that it really was a family-oriented business, and people would tell you, you're drinking the Kool-Aid. It can't be that good. I have recruited my niece, my wife, other friends, and relatives to work because I'm so proud of the genuine family atmosphere that I found here and how well they treat us as employees. And I think that's the key to it, where a lot of people will worry about what pay is, what's your pay, but you job to job to pay. If you're treated well and, with respect, I think a lot of people appreciate that just as much, if not more. And I can't be happier with everything they provide to me. And I genuinely feel not only within my own team, but throughout the company, it truly is like a family.
Oh, that's awesome.
Yeah,
How
I
about
have
you,
to
Ashley?
agree. I totally agree. I think that, I had come from, I thought I was going to be a speech pathologist or an audiologist. That's what my degree is in, communications and speech and hearing sciences. And then I got sidetracked and I ended up in retail for a long, long time. And it all happens for a reason, right? I love customer service. I love building relationships. I love talking to people. And most importantly, I love helping people. And so I remember finding Bayata just randomly online, and they had this leadership program, and it between the leadership program and the training that they wanted to provide me, along with the mission statement of Bayata, right? These core values of compassion, excellence, and reliability. And reading the mission statement as it is, what we call the Bayata way. It's not a cult, I promise you. We don't drink the Kool-Aid, but it's a document that really just outlines a good person, right? Being a good person and caring about other people, and putting it in black and white, putting it down in black and white on what that means and how to do that. It was already who I was, and I felt like reading that really was just a reflection of what I already felt like I wanted to do with my life. And there's a thing on our website that says the Bayata way is our shared true north, right? That embodies the essence of what we stand for, believe in, and value. And I totally believe in that. And I found my forever home with this company because I feel like I can be myself and help other people and make a difference.
I so agree with that, because if the employees are happy and they're comfortable, they're going to work harder to stay where they are. So they're going to make the clients feel better, and they're going to make the clients happier, because you're not going to want a bad review. You're not going to want to have somebody, be able to rip the rug right under you. Happy employees make happy, clients in the world. And I just think it's and I have not heard anybody complain about anybody from Bayata. That's where I refer a lot of people to when they don't like the services that they're getting from elsewhere. It's just so important to have like that right connection. Like, even when I had found somebody before I went to Bayata to get my services, they sent me two people on two different occasions that were deathly afraid of dogs. Well, I have a 190-pound Great Dane and an 80-pound Pit Bull. They're both service dogs, but they're bigger dogs. And I had even said on the phone, they're big, giant babies, but I get it. Their size. I mean, my Great Dane almost is eye level to me in my chair. And they sent me two people that were deathly afraid of dogs. I'm like, really? Like, this ain't going to work. I can't even get them in the door. You know what I mean? Never mind, work with me. So
Yeah,
and Bayata, right away, like, oh, we got people that love dogs. So, and they would sit right down and let the dogs lick them and say hi. And the dogs within 5 minutes were completely comfortable and went and go lay down on their own, and, were fine. But nobody else went out of their way like that. That's the difference. That's what makes good customer service, is knowing the ins and outs. And I live, like, I'm home alone most of the time. So I said, just tell the nurse to walk right in, because for me to get in my chair, to get to my front door, it's a grace of God. Just tell her to walk in and I'm on my couch. And where other places, like, we can't do that. You need to come in. I'm like, do you know what that's like to come and open a door?
Yeah. And I
So
think
have
it's
you
what
had a
Ashley
lot of
said before.
experience like that? What was
Yeah,
that?
what she said before about, I was going to say, like what Ashley said before, it really is like Bayata has the Bayata match, and it really is like a dating service. I mean, your goal internally and in the role of, it's called the client service manager, but that is their true calling, is finding that perfect match, the field employees and the families and the clients that all mesh together, copacetic. Yeah.
Right.
Yeah, and that's
that is so true.
That's the great part about what we do too, right? And I said it before, it's really, home care cannot be transactional. It cannot be like, we don't make widgets, we don't, stock shelves, and there's a place and a time for all of that. And some people might just want somebody to show up at their house and they don't care who it is. But for the most part, I think people want to, explain what they're looking for, and somebody that has, been trained and experienced. And all of the clients that we provide services to need some type of medical care. So we're sending a licensed nurse, a licensed CNA, we're sending, medical professionals there, and we want to make sure that they have the training that they need, especially with, and I wanted to make sure I mentioned this at some point, that we take care of trach invented children, infants, pediatrics, adults, seniors. Not every nurse can take care of a trach or handle a vent. You have to have experience with that, right? So we try to make sure that our nurses get that training beforehand, because I remember my first home visit that I went to, because I didn't know a thing about home care before I started with Bayata. One of my first home visits, I walked in and it was a gentleman with ALS. And I remember it to this day. I mean, there was the beeping sounds that reminded me of the ICU, and all of the medical equipment and the boxes of supplies. And there were two people there taking care of him at the same time. And I was just floored that that type of care occurs in the home. And did his neighbors know that all of this was happening? Yeah. Probably not, right? And I had no idea because I had never seen it before. But it made me feel just this sense of like, I guess I was in awe, but I also felt like if anything happened where myself or my family needed that kind of care, that's where I'd want them to be. I want them to be at home, if that was possible. Right. And it was possible for that gentleman. And it just astounds me that so many people out there just don't understand the capacity.
And that's it. I mean, especially with all of COVID, I mean, can you imagine some of that care where you can't see your loved one, or you're watching them unfortunately pass away on a tablet? I mean, how sad is that? Your care and your recovery and your health, your life is based on the people taking care of you. If you got good people taking care of you who truly care, your recovery is going to be that much quicker. You're going to have that amount of life back. You're going to have the will to want to get better, to want to do more. If not, if somebody's just coming in, changing you, dressing you, and leaving, you're like, why bother? This is my life. Why get up? But they're talking to you and they're making you important and they make you feel good. That's what important, and that's what Bayata does. That's the quality of people that you have working for you guys, is they make you want to be better. They make you want to do the next level, to get to the next step, to be better. And we thank you for that. And everybody needs to know about you guys, because you guys impress me. Because I'll tell you, I wouldn't be talking today. 1 year, I got my full voice back, my full left side back, and I am back on the stage talking to people every day. And it's because of the great care that I've received. And I can't thank you guys enough, because I had to go search you guys out. Nobody was coming my direction. And that was amazing to me. I think they were all afraid of me.
I was so happy to be able to do this job. And again, like, I know you're saying thank you to us, but it's really because of the CNAs and the nurses and the therapists on the front lines that are doing this work. And, Mike and I in our positions are really just trying to support them and our clients. Right. So it's really, it's a magical thing when you love what you do and you don't feel like it's work every day.
Yeah.
It might be the only really positive thing. Oh, I was going to say, it might be the only positive thing to come out of COVID. Yeah, the only positive thing to come out of COVID is the awareness of what the frontline worker truly is and how much they deserve to be rewarded.
Oh, absolutely. And we're going to make all of your clients red bag carriers, because if you guys don't know what the red bag is, it's carrying all of your medical information on you at all times, non-tech based. I just spoke in front of over 5,000 first responders from across the country, because this is now a national initiative that we're doing, and they absolutely love it because it works for everybody. So we're going to make sure that we partner with Bayata, and we're going to make all of your clients red bag carriers along the way, because it's something, you know what I mean, that's definitely that we can work together. Because I'll tell you, it saved my life twice. When I took my stroke and ended up passed out in the emergency bay at Miriam Hospital having my second stroke, I drove myself there and had the stroke in the truck. They had my medical bag and had my entire medical history and had me up and moving within 24 hours, because they knew what was going on with me right away. So it does save lives. And, I love those people who say, I have it on my phone. Or I said, that's great. If there's a power outage or a hurricane, You tell me, or don't die yet. Give me your passcode to your phone so I can get in and get your medical information for one. I mean, seriously, think about it with all of the stuff that we have. But I want to thank you guys so much for being part of this. Make sure you guys share this out to everybody watching. Make sure you share this out and reach out to Ashley and Mike and let them know what your needs are. We will type in their information in the chat box underneath this, so that way you guys can reach out to them. Or you can just go through RAMP, and I will make sure, because I have their personal phone numbers, so I can bug them anytime I want. How far does Bayata stretch? Is it, I know it's not, is it national?
We're actually global. So we have multiple
even better.
countries.
See that?
But we're in 22 states across the United States, and we have over 340 offices.
Yeah, RAMP went national in 1 year, and now I'm working with companies that are national. So if you can hear me from RAMP right now, you can find a Bayata in your neck of the woods, and you can be fully taken care of. And don't drink the punch, but drink the punch because they're fabulous. So you want to be one of them. So just do it and have fun with it. But thank you guys so much. And like I said, I will be reaching out if I have anybody who contacts me, but put your contact information in the chat box below, and then we'll share that out. And hopefully you guys will get a lot more clients, because you guys are fabulous for what you do. So thank you so much.
Thank you for the opportunity, and thank you for what you do.
Have a great night, everybody.
You too.